All right. So it's 6:32, so we'll go ahead and get started. Thank you for being here tonight. My name is Pa Van Goldbeck. I'm the Assistant City Manager with the City of Ames. And tonight we will be hearing from Analytic Insights, Dr. Flowers, on addressing homelessness here in Story County. So before we get started, I have just a few housekeeping announcements. So thank you all for being flexible and pivoting with us as we watch the unpredictable weather. So for folks who are online, you can only see me, but there's some folks here in the library. And then there's also a lot of people online, 84 participants online. So there's a lot of people here tonight with us. So that's really exciting. But with the unpredictable weather, just a couple things to keep in mind. Hopefully we don't hear any sirens go off or anything like that. But if we do, the library staff is prepared to help us. So we would just exit out these doors. They will direct us where to go. Hopefully there's no power outages or anything like that, so folks can still continue online. And if there is, we will troubleshoot afterwards. So we'll figure out what to do. But thank you all for your flexibility on this. Obviously, if I could control the weather, we wouldn't be in this situation. So appreciate your flexibility. I want to start with just a few words, and then I will turn it over to Sandra King with Story County, and then to Dr. Flowers to go over the plan with us. So we have allotted 2 hours for this presentation, so there will be ample time at the end for any questions and answers with Dr. Flowers. And then I would like to ask that if a question pops into your mind during the presentation, please write it down, but hold off on unmuting and asking your questions until the end of the presentation. For those folks who are online, we have enabled chat, and so you can put your questions in there, but again, we'll address those at the end. And then we also have feedback forms available for this session. So for the folks who are in the room, they're at that table right over there. And then for folks online, we will show you the link at the end, but also we'll drop it in the chat for you to complete as well. And so please take some time at the end to let us know. We want to know what you think about what you heard today, what you think is missing from today's conversation, and where you think you can also help play a role in addressing homelessness here in Ames. So please fill out that form. Okay, I think that's all my housekeeping announcement stuff. So I want to start by just thanking the Ames City Council and the Story County Board of Supervisors, United Way and Asset board members who have supported and continue to support these efforts to continue convening the community around finding solutions to addressing homelessness. Through your leadership, we were able to hire Analytic Insight to help us assess what's happening in our community and what solutions we collectively can consider. And so admittedly, we gave the consultants a really tight timeline to work with. So January to April, it's not a whole lot of time. And the community is obviously so passionate about this dynamic topic. I mean, I think just thinking about the attendance tonight is a testament to all the people here who want to help. And so I appreciate everything that you guys are doing to stay informed and to contribute. And then lastly, I want to give a special thank you to our direct service providers who are out there on a daily basis, working with individuals experiencing homelessness. The work that you do is taxing and exhausting, but you continue to do it because you care. And so I just want you to know I really appreciate the work that you do. Last week, I had a chance to meet with several of you at your weekly meeting, and I'm just so impressed by your collaboration and willingness to work together. So thank you. Well, you all know that this past summer, our community saw a significant increase in individuals experiencing homelessness. And in talking to various organizations and service providers, it's clear that as a community, we have been and continue to seek solutions to provide services that meet people where they are so that they're not without a home. And across the nation, we know that this is an issue in major cities, in many cities. And so, we're not alone in dealing with this complex issue. If you're like me, some days it feels a little bit overwhelming because it feels like we never really get there, right? We may never really get there or have enough resources to make the progress that we want to. But I truly believe that we are making progress in this community, and that's worth celebrating. And I think an important strength that we have here in Ames and Story County is the willingness among so many service providers to come together and find solutions. And so I really want us to kind of operate from that point of strength, because homelessness really requires a multifaceted and comprehensive approach. And it requires us exercising a lot of strategies from various angles and agencies. And so I think that's why tonight is so important as well. We're coming together again as a community to hear about strategies that have the potential to move our community forward. And so really excited for tonight. So we will hear some recommendations from Dr. Flowers tonight about some things that we can collectively do. But also just let me set the expectations here a little bit too. Is it every possible suggestion? No, we're not going to talk about every possible suggestions we can do tonight. And are these recommendations that we'll hear tonight the only suggestions we should be investing in? Absolutely not. And so what this plan does is it takes into consideration the information that's been shared by the community and provides some areas to focus on with the potential to move the needle. And I do say potential because I think implementation is the critical next step. What we do with this plan and how we move forward is going to make a huge difference. And that's really what we need your help with as well. We need you to stay engaged in this conversation and in finding solutions. And so if we think about it, every day our community is responding to homelessness. And so it's an ever evolving thing as well. And so there isn't one or two organization that has a silver bullet or has a solution. And this truly needs to be a whole community effort. And so as you listen to the presentation today, which everyone is hearing it for the first time tonight, including our elected officials, whether you are an organization or a resident or part of a government institution, I really challenge you to think about how you can play a role in addressing homelessness as well. And so lastly, I just want to acknowledge the complexity and urgency of this work and encourage all of us, including myself, just to stay committed and to keep working together. I think we are on a really great path. And no matter where we sit in the community, what role we have, I really think that if we come together, we can address this issue. So thank you for listening to me. I know you didn't come to listen to me, so I'm going to turn it over to Sandra, and then she'll turn it over to Dr. Flowers. Thanks.
Thanks, Pa. Thank you for those words to get us started off on this important topic. I'm Sandra King, the Director of External Operations and County Services for Story County and Story County's representative on asset. Thank you for your participation today. As a community, we could not tackle this issue without you. So I appreciate your time and expertise that you're willing to lend as we work on this problem together. And as you listen tonight, think about what feedback you want to provide, because your feedback is definitely very appreciated. I want to echo what Pa said, thanking the elected officials, service providers, and other stakeholders. This is a topic that is very visible in Ames, but it's no less important in Story County. And as we work together, I know that we can, make homelessness that rare, brief, and non-recurring reality that it isn't for so many people who are struggling with it every day. So thank you, and I'll turn it over to Dr. Flowers.
Thank you so much, Sandra and Pa. And I'd also like to thank all of you for your interest in the topic of homelessness in Story County, and the City of Ames and Story County and Asset for sponsoring this project and for their guidance all the way through. I'd like to start out by telling you a little about the process of how we got here tonight. So we did some data analysis of existing data, including the PIT count and the housing inventory and some other basic data, census data, those kinds of numbers. We also looked at a large amount of literature that came from the city, from county, from Asset and IFA and some others as well, and did some interviews with stakeholders. And many of the stakeholders, providers and others, referred me back to additional data, to additional literature. So it really was an iterative process where I went around and around collecting more data, more literature, and doing more interviews with stakeholders. We also held a workshop recently, which some of you may have attended, and the feedback from that was also very helpful in reinterpreting and really coming to a better understanding of Ames and Story County and the particular situation there. So this is a proposed vision statement. This is really something that I wanted to get your feedback on. This should come from the community of Story County. And really be a vision statement of what you expect to see and what you would like to see around the topic of homelessness. So I'll read this out loud, and then I'd like you to think about it as we go through the presentation. And at the end, there's a feedback form with several questions about the presentation, and also asking for you to change this vision statement into something that you would support as being the vision statement for the city of Ames and Story County. Okay, the city of Ames and Story County envision a thriving, inclusive community rooted in innovation, sustainability, and opportunity. We are committed to ensuring a high quality of life for all residents through equitable access to housing, education, and essential services. Together, we strive to be a place where every person has a safe and stable place to call home. Our shared vision is a community where no individual experiences homelessness. And again, at the end of the presentation, you'll be invited to revise this statement as you think is appropriate for the community. So I'd like to start out with a little discussion of some data on the current system and shelter availability versus the area needs. And this table comes courtesy of Matt White, who produced the 2024 Iowa Homelessness Needs Assessment. So in terms of single individuals, first of all, the crisis response shelter capacity is about 62. This is a number that changes rapidly as organizations might disappear or change their capacity. They might increase their capacity. So it really changes month to month. But as of 2024, we had 62 crisis response shelter beds for single adults. And he assessed the need at 105, which left a gap of 43 additional spaces needed, or 69%, which is a substantial increase. For rapid rehousing, which is the kind of support that keeps people from homelessness, things like rental assistance while they're paying off a medical bill, or a down payment assistance to try and get into an apartment, that kind of assistance. There were 18 individuals available for that kind of assistance, and the need existed for 181, or a 906% increase. So a very strong need for rapid rehousing, especially for individuals. When it comes to permanent supportive housing, there's 40 available units and a need for 76. So a gap of 36, or an increase of almost double, 90% increase is needed there. And when it comes to families, there's also very strong need. For crisis response, the need versus the current system is 275% increase. For rapid rehousing for family assistance is 178%. For permanent supportive housing for families, it was found that there was adequate adequate housing that exists currently in the system for those who needed permanent supported housing. So no increase there was needed. And then altogether, overall, the total, you can see at the bottom of 174%. And this is also not just for Story County, but this is for the Two Rivers region that includes Boone, Hardin, Greene, Marshall, and Story counties. However, looking at the population distribution, I looked at individuals who are at half the federal poverty level. So the federal poverty level for a single adult is about $15,000 a year. So half of that is $7,500 a year, or about $625 a month. Those are individuals who are at extreme risk of homelessness and housing insecurity. And Story County, among the entire Two Rivers region, Story County accounts for about 72% of those individuals. So that might be why Story County is a center of homelessness and considered a place that many people look to for leadership on this issue, because the majority of people in need of housing are in Story County, and some of the other smaller counties may turn to you for support with their populations as well. And there we go. So in talking to people during the interviews and looking at the data and the previous reporting that's been done, it looked to me like there were 5 kind of basic community needs, or 5 needs that really came to the forefront. The first was for provider coordination, and it's true in many rural areas, especially where providers are separated sometimes by some distance, and it's necessary to have increased coordination to make sure everyone is communicating with each other and able to be aware of the other services that are available throughout the county. Improving homelessness prevention was also a theme that I heard quite a bit about, and in particular, that rapid rehousing piece, the idea of giving people the support they need before they become homeless in order to prevent homelessness. Increased case management was something many people mentioned as a need, especially for people who have mental health issues or substance use problems. The increased case management is necessary even if someone has a place to live. Sometimes a little case management can help them maintain that and provide a more stable housing environment for them. Expanding emergency shelter was a very large need that I heard quite a bit about. And I know the Bridge Home is currently under a temporary MOU and working on expanding emergency shelter for the county. And then lastly, the permanent and supportive housing was mentioned quite frequently. And it came really kind of hand in hand with affordable housing, the need to provide affordable housing for people who are at 30% or below the median income, that level of affordable housing is necessary to give people the stability they need, again, to avoid homelessness in the first place. So in terms of the plan, the strategic plan on homelessness, there are 5 elements to address in the first year of the plan. And these are the 5. To, first of all, continue to support on-the-ground service provider partnerships, which are already off to a good start, but need critical support in order to maintain their success. To build a peer navigator program, and expand a partnership with Iowa Works Mobile Workforce Center job fairs that have mobile vans that go out to reach rural areas of the county already, expanding the emergency shelter capacity, and providing robust case management services across the county. And we'll go into these one by one in more detail. So first, continuing to support on-the-ground service provider partnerships. The Ames Mental Health Advocate and the Alternative Response to Community Health, known as ARCH, started doing street outreach to individuals experiencing homelessness to try and find them shelter as cold weather approached. So ARCH started conducting a team approach meetings. They involved the Mary Greeley Medical Center, the Ames Police Department, the Salvation Army, the Romero House, Ames Community School District, Story County Alternatives Program, and others. And the group continues to expand. They have a pilot flex fund available that is granted by the City of Ames City Council to help individuals with smaller needs like obtaining an ID, purchasing a uniform that might be needed to start a new job, or other kinds of assistance like that. So the first item of the strategic plan is to continue supporting those existing agencies on the collaboration and the activities that they've already undertaken, but to help formalize their arrangement with an MOU for new organizations signing on, a subcommittee to develop the MOUs and parameters for participation, for eligibility for the flex fund that they provide, and for other kinds of formalized guidelines. It would be helpful to them, and it would be helpful to the community to be able to expand their reach. And on the topic of street outreach, Wrapping Up Homelessness is an example that I wanted to share. There we go. Of the Northeast Ohio Coalition for the Homeless. And it's also conducted, a similar program is conducted by the Chronicle in Oklahoma City, where they have a contest for people experiencing homelessness at the shelter to design art that is produced into wrapping paper. And the paper is sold on the streets by people experiencing homelessness. They wear vests in both cases so that they can be easily identified as having the wrapping paper. And it's also sold in local shops in the downtown area. And the proceeds go to support various homelessness services. The wrapping paper, and in both of these cases, they also produce a newsletter or newspaper around homelessness. And they really play an important role in establishing a relationship between the housed community and the homeless community and the business communities around downtown. People actually look for people who have the wrapping paper for sale, and it gives them an opportunity to engage with a person experiencing homelessness, to talk to them, to give them a little money, make a little change, get the wrapping paper that they were looking for. It's a very popular program in Oklahoma City and in Northeast Ohio. And so projects like that with a little extra funding and a little administrative support might be possible for ARCH to support as well. The second item on the list for year one is building a peer navigator program. And peer navigators can serve as a critical bridge to services for those who are reluctant to make use of them. And this is something I heard frequently during the interviews and during the workshop as well, that there are people in the community, in the Story County community, who don't make use of the services for whatever reason that might be. They might be distrustful, they might be anxious. Often people who have children are worried about making use of services because they're worried about what might happen to their children should they take advantage of services. So peer navigators can really provide a bridge to those types of individuals who are reluctant to make use of available services. They offer lived insight, they can be empathetic, and they can offer real-time guidance to where the shelters are, where to find health care, where to get an ID replacement or mental health services and other kinds of things that people need. The presence of peer navigators has also been shown to reduce conflict. and help promote long-term stabilization for the people they support. They often wear a vest or a badge or sometimes a bag, a colorful bag that they carry, or a hat, so that they're easily identifiable on the street. They're very effective in public areas such as the library or the public parks, where you might like to reach out to people experiencing homelessness. It's also a great support for the peer navigators themselves, who are able to contribute to the community. They're often paid a small amount of money for their services, so that provides a source of income from that for them as well. And they can distribute basic needs supplies like hygiene kits, snacks, resource lists. They can track their interactions and be part of a coordinated entry system as well. So the program to build the Peer Navigator program would include trauma-informed training for the navigators in topics like local resources, so that they're knowledgeable about those things, motivational interviewing, conflict de-escalation, forms for tracking contacts, again, so they can be part of the coordinated entry system, confidentiality, and ethics. And communities often partner with police departments or law enforcement and public space staff for orientations to make sure they're aware of the navigators, and the navigators are aware of who they are as well. The third item is expanding a partnership with the Iowa Works Mobile Workforce Center job fairs. And this is a picture of one of the vans that Iowa Works uses to go out to reach out to rural areas across the county and beyond. And so incorporating some services along with the mobile van would really help reach out to people who are already looking for work, who may be in danger of homelessness or at risk of housing instability. The providers could go with the van to be able to tell people about benefits that they might be eligible for, like Social Security or disability benefits, SNAP or Medicaid, to try and reach out and get them enrolled, help them get IDs or a mailing address and the things that they need to be eligible for those kinds of programs, along with employment opportunities. Expanding the emergency shelter capacity is something that I felt needed to be on the list, because I did hear quite a bit about the need to expand shelter capacity. You may be aware that already the Bridge Home is under an MOU with temporary new leadership and is undergoing a transitional period. So we don't want to go too far into the business of the new management there, but we do want to say that this transition represents an opportunity for the community to reach out and be more a part of the shelter and make sure that their needs are being met. And that they're also able to strengthen that shelter system as well. And the last item in the year one list is providing robust case management services across the county. And so this includes exploring the possibility of including a case manager or housing coordinator housed in general assistance within Story County. This would be a position that would supplement the existing provider's case management and understand their needs in the community and serve as a community facilitator to identify affordable housing opportunities and to coordinate their activities. This position could also convene service providers to promote shared learning around their case management practices and help build a community of learning among providers. So it would really strengthen the ability of the county and the city to provide robust case management services. In year two, we kind of move on to some larger projects and to building a stronger foundation. And so the first item is creating a task force on homelessness, and then going on to support developing efforts to provide all-weather daytime refuge, and aligning with or supplementing local funding for emergency housing. So the first item is creating a task force on homelessness. And the reason for this would be to assess ongoing needs, gaps, and any duplication in services, because this is a process. The development of this report and the strategic plan is really an evolving process as needs change from week to week and month to month, year to year. It's important for the county and the city to be able to respond to those changes and to be flexible and nimble on their feet. A partnership with existing providers like Host is critical for the task force's success, but they can also help coordinate providers and Host to develop proposals to access additional funding stream at the state and federal level. They can also help establish a community vision and some key performance indicators around addressing homelessness and hold providers accountable for addressing the community needs. They can also engage the community through listening sessions and public input so that they can build a bridge, help to build the bridge between the housed community and residents who are experiencing homelessness. They can also develop a comprehensive set of policy recommendations. And I see this task force as being essentially a policy body, responding to emerging issues, such as the recent debate on camping bans, providing information around that, and communicating with the public to make sure they're informed. They can weigh the use of tiny homes as part of an overall strategy, and look at any zoning and land use barriers to affordable housing. They would also coordinate teams of providers in collaborative grant applications. Often larger funders like to see combinations of providers so that a full array of services are being offered. It makes the funding more powerful, and it makes the funding application more likely to succeed. The task force would also align with the Iowa Balance of State Continuum of Care. Story County is part of the Balance of State, and within the Balance of State, it's often lumped into the Two Rivers region. And I think it's important to increase the visibility and for people to understand what an important hub Story County is. And the task force could go a long way in making that known to the continuum of care, that Story County is an important presence in the provision of these services. And then lastly, they can coordinate with existing regional and statewide planning efforts to make sure that, again, Story County is represented in those efforts. If you remember on the first chart that I showed on the data, we looked at the Two Rivers region. And it may be important to work with the other counties, with Boone, Hardin, Greene, and Marshall counties, to make sure that all are aligned with Story County in their plans as they develop the strategic plan and move forward with their activities, and make sure that they have the support of those counties, since it does draw some homeless people experiencing homelessness from those areas to make use of the services available. The counties themselves may be interested in helping with the planning and even the funding as you move forward. The second item is supporting developing efforts to provide all-weather daytime refuge. And this evening seems like a perfect time to talk about the importance of all-weather refuge during the day or in the evening. Story County has several options to consider to extend capacity for all weather conditions and emergencies. One of them may be A rotating space such as between high school gyms, community center, and other kinds of areas to make sure that people have a place to go. The navigators that we discussed earlier could be instrumental in letting people know where that all-weather refuge is, where they can go for the day, since if it is a moving location. And so those efforts will be important not only to people experiencing homelessness, but to other people as well who are housed, but perhaps aren't able to afford secure housing that includes air conditioning or heat during the winter, who need a warm place to stay during the day. The third item for year 2 is aligning with or supplementing local funding for emergency housing. Given the high percentage of renters who are cost burdened in Story County, a high percentage spend more than 30% of their income on housing, which puts people in somewhat of a danger zone of housing insecurity or instability. So it's important to make sure that there's local funding available for someone who might need a month or 2 months reprieve from the rent to be able to address another need like a medical bill, or who might have gotten behind and is having a hard time catching up. In addition, some disproportionately impacted populations like seniors, single-parent households, and people with disabilities are also likely to access that kind of funding for emergency housing needs and avoid shelter entry altogether. ASSET currently distributes funding for human services needs, and the funds are used for a wide range of services. It's very important for the community and very appreciative of the help that they give. But a focus on investing on early intervention and an increase in that fund if the city or county could find, or others could find, a funder to supplement that funding that's available, it would go a long way to helping people avoid homelessness in the first place and have community-wide benefits. Year 3 is kind of the big project at the end. And the reason I put this at the end in year 3 is that the development of the task force in year 2 is partly for the purpose of coordinating providers and bringing the community together to a place where the funding can be secured for a larger project. Some of the smaller projects like the peer navigators or something like the wrapping paper project, those help to build community support, to build a better relationship between the housed and the unhoused communities, so that you can have the support needed, the public support needed, and the public will to build something larger. And I think Story County and the city of Ames would really benefit from a mixed use, permanent, supportive, and affordable housing project. So this would not only provide permanent supportive housing for people who have been experiencing homelessness, it would also provide some affordable housing to give relief to the people who are housing insecure. The plan calls for about 20 to 30 units of permanent supportive housing. So that's housing for people who need some extra case management services in order to be stable there. Another 30 to 40 units of affordable housing for residents with incomes that are less than 30% of the median area income. And 30 to 40 units of senior affordable housing. So the task force established in year 2 might also want to consider some on-site wraparound services for those who are in need of the permanent supportive housing, like healthcare and case management services or meal services. And they might also want to consider some portion of a mixed-use commercial space either a community clinic, a food co-op, daycare services, even shops would be a helpful addition that would help pay rent and stabilize the facility. So I wanted to circle back again to this area needs calculation. I was talking about 20 to 30 units of permanent supportive housing. And if you see here, the assessed need was for 76 additional units of permanent supportive, or I'm sorry, 36 assessed units, additional units of permanent supportive housing. So I went with a slightly lower range of 20 to 30 units, thinking that some of those 36 individuals would also be residents with 30% or less of the area median income. So there might be some individuals who take advantage in different ways. Some of those individuals might also be seniors. So there's some flexibility there between those categories and the kinds of housing that would be available to people. But the idea behind the complex is that it would have a mix of people, so it wouldn't just be people experiencing homelessness or people who are in need of permanent supportive housing services. It would also include seniors, families, and others who are in need of affordable housing in the area. And so I wanted to leave some room for discussion, which is now. I also would like to call your attention to the feedback form. And this is a QR code. If you have a phone, you can scan this and be taken to the survey, or not the survey, but the feedback form. It includes the proposed vision statement that we started with and some additional questions about the solutions presented here and your thoughts. I look forward to hearing your feedback from the feedback form and also during the discussion. So I'll stop sharing a screen so that we can see each other. And let's see if I can, there. And I'd be happy to take your questions.
So I'm gonna try and figure out how we do this. Okay, so we've got folks in the room and we've got folks online. And so maybe we'll start with a few questions in the room and then we'll open it to you folks online. So.
Yes, good evening. Can I ask why you're waiting until the 2026 to do the task force? Why not start the task? Is there a reason not to start the task force right away?
The idea behind waiting till the second year to start the task force was to start off with some small wins, to kind of start with increased coordination and working together and build up to the task force. That's something that we can certainly consider moving up as well. Thank you for that.
Anyone else in the room? Okay, one more.
Introduction of Dr. Flowers.
Oh, yes. Yeah. So Dr. Flowers, can you introduce yourself?
Oh, I apologize. I saw the comment in the chat too, and I'm sorry, I completely forgot to do that. So I'm Amy Flowers. I'm president of Analytic Insight, which is a small consulting firm. I've done about a half a dozen similar kinds of strategic planning on homelessness, as well as probably 100 or so strategic planning projects around food insecurity, services for people with disabilities, coming out of foster care, a wide range of social issues.
Thank you. Okay, so there are some folks online who have submitted some questions, so we'll tackle those. give me just a minute here. So does the current system numbers include the bridge home proposed growth units? If not, do we have a read on timeline and viability?
No, the current system numbers do not include the bridge home proposed expansion. And so I don't know what their timeline is for that expansion.
Okay, so the second one online is, so for families with loved ones who are felons, bad credit, or not enough time in the area in need of assistance, what's going to be done about keeping families together? Lots of rental property owners push away 75% of people who have had these, which is one of our biggest issues as well. Families have a hard enough time finding and paying for a place than to split a family up because of it, and then having to pay two rents between the families too high in prices, especially here in Ames. We need to have a new guideline set up that allows more families availability with rental properties to have a home and keep their families together.
I couldn't agree more. Absolutely agree with that sentiment. And that's why I think it's important to address both affordable housing and homelessness to be able to prevent people from slipping into homelessness in the first place. Thank you for that comment.
So if you would like to ask a question, please raise your hand. Loris, I see that you have your hand up, so go ahead and ask your question.
Okay, thank you. Thank you, Dr. Flowers. It's clear that you've gotten a lot of information. There's always more groups you could have talked to and more information you could have gotten. All right. My concerns are based upon, as a journalist who covered this community and the county for a long time, and then was a county supervisor, and now is operating a very small pilot project. And what I find is we need housing now. And everybody talks about what a difficulty housing is in Ames and as our largest city, but we literally, I don't feel, can wait 3 years to look at adding more units. So I would like to see some more consideration given to what can be added that would occur in the next, 6 to 12 months by working with private landlords. We already have volunteer committees made up of various service providers that are trying to do that, but really could use some organized help from elected officials and some funding to help fund something that puts more people into housing, apartments especially. Are you aware of any programs that work very collaboratively with private landlords to get that extra incentive to them that's ongoing? Thank you.
Thank you. And I believe there are some service providers who will work with landlords and intervene with eviction prevention. But I also think that there's a very low vacancy rate in Story County, which makes it very difficult. It makes it difficult to work with landlords, and it makes it difficult to find housing. So those are really critical issues. Thank you.
So I'm told it's about 6%, just to let you know, which is a pretty standard vacancy rate in a lot of places. Thank you.
So there's another question online. Do the Story County numbers of those in various low income categories in that slide, did you take into account the college student numbers?
Yes, the college student university housing needs were also included in the analysis that was done by Matt White with those figures in the table that I showed. So yes, those were included.
And then how have people with lived experience been able to inform the plan for Story County?
I'm sorry, I didn't quite hear that.
So how do the people who have lived experience been able to inform the plan for Story County?
I'm so sorry, I still didn't quite get it.
So how have people with lived experience been able to inform the plan for Story County?
I see. Thank you so much for repeating. I did spend a day at Food at First and interviewed several people experiencing homelessness there. Their needs and opinions were really instrumental in understanding some of the needs for increased emergency shelter, especially. Um, Most of them were experiencing chronic homelessness. There were others that were families that were in less of a chronic situation, but all really emphasized the need for additional emergency shelter.
Another question is, have developers willing to build affordable housing been included in the proposal? And are there any developers interested in supporting the mixed use development by year 3?
So I don't have any developers lined up for you. That would be the job of the task force to identify those. I do have a case study to offer from Hennepin County where they put together a similar kind of arrangement that has been very successful. And that is available in the report.
So how did you decide that 50% of the federal poverty level was the income line where people would be housing insecure? That number seems very low compared to the cost of living and housing in Ames.
Yes, indeed. I agree. It is very low. And because I wanted to look at people who are at the greatest risk of homelessness and housing insecurity, that was why I picked such a low level of income.
Okay, so Sarah, I see that you raised your hand. Do you want to unmute and ask your question?
Yes. So honestly, I'm gonna be so for real. Like the task force being delayed to me is morally abhorrent. Like we need to get solutions as soon as possible. Like I'm sorry, that's not workable. Like a 3-year plan. And the other thing is like I'm also kind of wondering like basically it's like at a certain point it's like why is it taking so I feel like mutual aid network actually possibly do a better job at this because like a task force should not take that long to assemble. This would be made in like frankly a few months, honestly.
Okay, we'll consider moving that up. We'll discuss it.
And then Kelly, do you want to unmute and ask your question?
So, as a mom of 4 children, married, and has been in this situation, I have to agree with the statements of why the task force is being put off so far away because there's so many people that need that now and not later, because you have people that are felons, you have people that are have bad credit history, haven't lived in the area for enough time to be able to be okay to have a place. We need to start talking to more people outside of our normal, like, I was approached at my voting station and was asked what my thing is biggest when it comes to homelessness in Ames. Families should not be split unless there's absolutely reason for it. But where does the families get more assistance? Because in order for families to pay their bills, have we even looked into more childcare programs that will take childcare assistance for these families so we can still continue to pay our bills?
childcare assistance wasn't part of this plan directly, although it was proposed to include childcare as part of the affordable housing facility so that it's available there close by for families that need it. I agree there's a lot of needs to address. This is just focused on homelessness as one particular need, but it's related to many of those other social issues as well.
All right, a few more questions through chat. So with the uncertainty in federal grant funding, what are the proposed financing solutions to cover the cost of staff, rent, and ongoing supports?
That is a difficult question. So I agree that federal funding is something that is a little bit questionable moving forward over the next few years at least. And state funding, private partnerships with private industry, with business are really important. Foundations and other private funders are the focus of the plan.
And then does the consultant have anything to say about why there has been an influx of visible homeless people in Ames in 2024 to 25? Is this temporary and could it reduce just as fast?
I'm sorry, I don't think I quite heard you. Could you repeat?
Yep, I will. So, does the consultant have anything to say about why there has been an influx of visible homeless people in Ames in 2025 to 24? And is this temporary or could it just reduce just as fast?
Okay. So several of the surrounding counties do not have homeless shelters currently available. So that's one reason people might want to come to Ames in particular, to find shelter and to find services that are needed. I think Ames is a central hub for Story County, and Story County is a central hub for the Two Rivers region. So people tend to gravitate toward this area. We've also seen some economic hardship where people have lost jobs or the cost of housing has just not kept pace with the income that they're receiving. And the result is a tendency to fall behind and then to eventually face homelessness. So that's kind of, it's not unique to Story County by any means. It's a problem that's been nationwide, although rural areas seem to have a special combination of problems that include transportation and the ability to reach people, the tendency of people to shun services and to try and make it on their own. I think those are unique to more rural areas like Story County.
Okay. I have not heard anything in the news for a very long time about Story County Community Housing Corporation and the work they have done for the community. Will they be looked at as a model for affordable housing?
Yes, absolutely.
All right, Dr. Flowers, you mentioned the work done by Asset and also the need for more funding and funding that is focused on housing issues. The task force seems like it might be duplicating some of the work of Asset. Can you tease out for us what the relationship of the task force would be to the successful functioning of Asset, and also try to help us understand how the two processes could coexist, at least in the short term?
Yes, Asset is a local funder. And so the task force would be more of a neutral party and would not be a direct funder. Asset would certainly be a critical component and a member of the task force, but they wouldn't necessarily be the whole task force. It needs to be larger than that, than a single funder. And also, I believe Asset's focus is more on the provision of services and the direct needs of the community, which is a critical role for them to play. But the task force has more of a policy focus and a focus on finding additional external funders to participate.
So I have not heard anything about the influences of state and federal policy on the homeless issue. Why has nothing been said about that?
Partly, I think the state and federal environment is somewhat of a given. So I think, for example, there are some states that have very robust funding for homeless shelters and other services. Iowa is not one of those states. And given the current environment that surrounds the county, I think it's important to look for private funders and foundational funders, people who are available in that way to fund these kinds of programs and services. Certainly, the state does play an important role, and also the COC. So the plan does include increased roles for those entities.
So how do hospitals like Mary Greeley and healthcare systems currently address housing instability as a health risk factor, knowing healthcare and the workforce are leading causes?
Yes, and often healthcare systems will fund larger projects related to affordable housing and homelessness because it does reduce emergency room use and hospital use and ends up saving them money in the long term. So I believe Mary Greeley is already a partner in several other homelessness entities and would be an important voice within the task force and the other projects as well.
Is there anything in this plan that speaks to working with other communities, since other surrounding communities influence the homelessness issues in Ames?
I'm so sorry, I lost the last bit of that.
So is there anything in this plan that speaks to working with other communities, since other surrounding communities influence the homelessness issues in Ames?
Yes, and so I think within the Two Rivers region, coordinating some of the other counties around Story County would be really helpful, and I'm hopeful that they would be willing to contribute and to be part of the decision-making process.
So how does the plan include increased roles for the balance of state COC, with the Bridge Home as the lead agency for Two Rivers region?
Yes, and I think the Two Rivers region is important to include, especially in the development of affordable housing, because that would also serve those other communities as well. So the plan does include as part of the role of the task force, increased involvement in the COC to make sure that Story County and the Two River region is a visible presence for the balance of state.
The plan proposes more case management and having someone stationed at the HHS. Who would fund this and how large would be their caseload?
So the funding has yet to be determined for that central case management position. Although I believe the county has been looking at that and considering the funding opportunities that might support that position.
Kelly, I see you have your hand up. Do you want to unmute and ask your question?
So my last and final question here for this evening is, when it comes to this task force that you've been discussing, who is going to be part of that? Because in my personal opinion, you need to have people that have experienced or have been experienced homelessness to get these factors and policies taken care of appropriately to make sure that we are helping everybody. Is that going to be something that's going to be able to be done? Is having ones that have experienced it or are already experiencing it be part of that task force?
Yes, it is. It is in the plan that there should be a representative from people with lived experience of homelessness included in the task force.
So can you talk a little bit more about host?
Oh, I think I would defer to either Pa or Sandra, who is more of an expert on host.
So I can start maybe, and Sandra, you can fill in. Host is a homelessness outreach services team. I think that the city's police department has been part of that. The ARCH team has been part of that. Mary Greenlee and several of the service providers, Salvation Army. I'm not gonna get all the names, so I apologize about that, but it's a group of service providers who have been doing outreach together every week since I believe they started in either late October or early November. So it's a collaborative effort by service providers to do outreach to the individuals experiencing homelessness.
Like Pa, I had the opportunity to attend one of Host's Friday morning meetings. They meet every Friday morning at 10:30 at Optime. And I too was very impressed. It was a big group of people. I was expecting to go into a room of about maybe 6 to 8, maybe 10 people at the most. It looked like there were maybe 20 people there. It might not have been that many, but it seemed like that. The energy in the room, you could just feel it. Everybody was willing to help. They were sharing information. It was just a dynamic group of go-getters. And you can tell that they just sort of came together on their own. They sought funding to continue their efforts, and it really does sound like they're making a difference. I believe the city allocated them just over $11,000. And it sounds like they have been making quite an impact by using, I believe, less than a third of the allocated funds. So these are the type of efforts that we really want to be able to put in place, use the funding that we have, try some innovative outside the box thinking kind of initiatives, and study that and see if it's something that can move the needle. You know that millions of dollars doesn't come easily. So we're looking at trying to do some different things with what we have. And Host is a perfect example of that.
I will just say too, and I'm saying this off the fly without checking with anybody, but I mean, there's no reason why we couldn't bring the host team here to the library at some point and open it up to the community too, and you can meet the folks and ask questions as well. So that's something maybe we could do as a next step. Another question. Well, actually, there's someone who has their hand raised up. DJANVRIN.
That's me. Oops. I don't care if I'm on the camera or not. My question is that one of the solutions is to try to get some private donations and private businesses to help funding. I guess kind of opposite from the last comment. My question is, how do we communicate with those potential donors about the homeless needs and the needs for the child serve issues, etc.? If you've got any ideas on that, it's something that we've been trying to work on, and it's kind of difficult to try to communicate all these needs to people that might be able to help us out. Thank you.
Thank you for that. And I think it's really important to communicate effectively and to have a message that will resonate with them. So for the business community, for example, that's why I brought up the idea, the example around the wrapping paper. For the business community to see that people experiencing homelessness are actually drawing people to the downtown area because they're looking for wrapping paper. For them to be able to offer the wrapping paper in their stores, it helps build that bridge to the business community. And it's not easy to find those areas of commonality. Often it's around people who are veterans, people who are seniors, families experiencing homelessness that really tug at people's heartstrings and make them realize that this is an issue that can affect anyone.
So can you talk a little bit more about how a proposed public camping ban would impact people experiencing homelessness and the community more broadly?
So from the interviews that I did, I got a little bit of perspective on both sides of the camping ban. I believe the idea behind it is to provide some leverage so that the police or other individuals can tell someone experiencing homelessness who is on a park bench or impeding a sidewalk to get them to move along so that they won't be a hindrance to other people who'd like to enjoy the space. Uh, at the same time, the camping ban often has the effect of moving people away from the areas where they can get the services that they need. So it's often detrimental, especially if there's an arrest that's involved. It puts an arrest on someone's record, makes it more difficult in the end for them to be housed or to find a landlord who will take them on. So the camping bans, people, I think they are an expression of frustration where people want to reclaim public spaces. My preference would be for the use of navigators and increased prevention methods to try and reclaim those spaces, but also offer people the services that they need and the help that they need.
My name is Janie Heath. Oh, go ahead.
Go ahead, Janie.
I'm having trouble finding where I can raise the hand, so that's why I wanted to jump in really fast. My name is Janie Heath, and I'm one of the case managers with the Bridge Home. And I kind of want to explain why there's an increase with homelessness. We are not, I'm an exception to the staff because I have a background in mental health. So we have some people, some clients that have severe mental issues that override the housing. And you can't make anyone with or without homelessness use the services. So that's a big struggle. And you don't want to make them homeless because they won't accept those services. So it's a double-edged sword. Sometimes the mental illness cause reactions where they may be removed from the program back on the street, or we keep them as clients, which is a bed that can be used for someone else if we had more inpatient mental health clinics. So I feel like we need more. If we're building more shelters, we should also be thinking about building more inpatient mental health clinics, because I believe that would also help with the availability of beds, if that makes sense.
It does make sense. Thank you for that.
Another question is, how do we combat the not in my backyard mentality when it comes to affordable housing and other homeless solutions?
That is a really difficult problem. And I think one of the keys to combating the not in my backyard attitude is for people to realize how pervasive housing insecurity is, not just homelessness, but that, I think the chronic homelessness is kind of a visible face to homelessness. People often don't realize how many people might have a job but are living in their car, or are couch surfing between relatives and friends because they can't afford a place of their own. So I think part of combating the not in my backyard mentality is getting people to understand that it's already in their backyard, that homelessness and housing insecurity is pervasive all around them and affects many of the people that they probably already know.
Okay, we have a question in the room, so I'm gonna walk over.
My name is Donna Nelson and I'm just a resident. But I have a connection with one of the area funders that is not based in Story County, but is rather based in the Polk County region, which would be Des Moines. And I see us as being so far behind in actual physical space to put these people, and fairly or unfairly, some of the funders outside Story County, but which would have been sources of money. When we got some money last year, we had to burn through it for emergency hotel room housing. And so then it wasn't available to go into broader projects that people were envisioning. And now some big players don't even have enough of the mental health services and the other support services that they need to run their home bases. So my question for you is, have you worked with the community where, and you can disagree with me, but I feel we're way behind on the actual housing part. Have you worked in a community where they did something to get their credibility back in this world of shrinking funding to be able to build the housing piece, to have a place to put people so we can get some emergency funding back? Thank you.
And I have, and in my experience, funders like to fund projects that are innovative and interesting to them. And so I think that was part of the idea behind the mixed use development, is that it's a little bit inspiring or different or innovative to catch the eye of a funder who might not be from Story County, but might be within the state of Iowa, might be even from, another area altogether, but is interested in seeing an innovative community-based development, and would like to see it succeed.
So recently, the city of Ames dedicated just over $11,000 to a team of local health providers to help expand homelessness outreach and the services that are offered locally. So how much would the proposed actions suggested in your report cost?
In the report, there's a cost estimate on each of the individual items. There's clearly going to be some decision making between what's the highest priority and what's a lower priority, where the funding opportunities are, and what's most likely to attract funding. So those kinds of decisions I'm leaving up to the city and county to make, as well as the stakeholders who make those decisions. But the costs are included. Costs are estimated in the plan.
Is this plan going to help displacement, like the tenants in the Welch Avenue apartments in Ames? So there were a lot of students and low-income residents in these apartments who were forced to move. How are you planning to combat the city's focus on modernization and replacement or gentrification?
I can't speak to the particular development on Welch Avenue. However, I think that certainly gentrification is an issue, and the idea is to increase the availability of affordable housing to make sure that people have a stable place before they become homeless. And that would include some students as well.
So who will be responsible or in charge to get these actions accomplished, and who is accountable to the community for implementing this plan?
So the responsibility is really dispersed depending on the particular action that we're talking about. So it really is going to rely on not only the city and the county, but also on some of the local providers, the funders, and others in the community. It's really up to you in the community to make it happen. And as Pa said at the very beginning, I think of the presentation too, implementation is really the key. That's where it really either happens or it doesn't, is in the implementation and in the community, making sure that providers and others move forward.
Do we know the number of families who are experiencing homelessness or on the verge of being unhoused within the Ames Community School District?
It's a very difficult question because it changes every day. So people move in and out of homelessness frequently without really being seen. And in my experience with school districts, especially, families often hide the fact that they are living in their car or they're living with friends. They're essentially homeless. They hide that because of fear that their children will be taken away if it's discovered that they're homeless. So it can be very difficult to identify people in that school context who are experiencing homelessness. But it's really important to do so because help is often available for them if they reach out.
So I see a couple hands raised. Jan, Lee, if you want to unmute yourself.
I was suggesting that a place to find out more about children in families that are unhoused is to ask the school nurses for the range of what they are here, not to identify individuals, but to share information about what they find out in the course of caring for the children. And the second thing is, I came on the call a little late, for which I apologize. Could you please tell us where and how to access the full report?
Great question. I haven't reviewed that yet. It is online on our website. So we'll drop that in the chat as well for you. But if you go to cityofames.org/homelessness, it should take you straight to the page. And we make that available starting at 6:30. So you can all hop over there if you're on a computer and see that full report as well.
Thank you.
And then Terry, if you want to unmute.
Yeah, I just had a question on, do we know what the percentage of the homelessness in the city of Ames is that are part of the LGBTQ community?
I do not think we have that information, no. There is, although actually there is some information available through the pit count. It does collect that. And I hesitate to guess. I'd have to consult a previous report, a data report. I did not include that on the overall report, but there was an estimate. It tends to be a very low undercount, but they do estimate for the pit count for the one night.
Okay, we're multitasking here. I think we're caught up on the questions, so. Oh, one more, and then I'll ask that you guys unmute going forward and ask your questions there. So the question is, could you explain the pit count for those who weren't on the first call when you explained it?
Yes, so the pit count, it stands for the point in time count. it's mandated by HUD that it's done once a year for the sheltered population and every other year for the unsheltered population. I believe in Ames, it's actually done twice a year. And it's once in January and once in June. And a force of people go out and they try to identify all of the homeless people that they can find and provide a count. They also have a questionnaire that they fill out briefly for things like health conditions, mental health, LGBTQIA status, those kinds of questions as well.
All right, another question. So Dr. Flowers, have you worked with other college towns? And if so, do they face some unique issues that were considered in this proposal? And then as a separate question, how are non-English speaking persons assisted or considered?
Okay. Yes, I have worked with a few other college and college adjacent towns, and they do face very similar issues in the sense that college students often have a large number of students sharing a single apartment, and that can drive rents up. And they also tend to be seasonal. There's a lot of things that impact the housing market being adjacent to a college. So yes to that. And I'm sorry, what was the second part of the question?
How are non-English speaking persons assisted or considered?
Yes. So we really didn't account for directly for the need for interpreters or other kinds of personnel to address non-English speaking residents.
Then Amber Tompkins, if you want to unmute and ask your question.
Yeah, so mine's more of like a comment than than a question. And so I really love hearing all of the, enthusiasm around helping the folks that we serve. And I just want to remind people that these are suggestions on timeline, and we absolutely can, look at how do we collaborate as a community to be able to move those timelines up. And so I am with Central Iowa Shelter and Services, and so we are working with the Bridge Home right now. And I know that some of the things that we're working on is, getting people to the table, people with lived experience, and other providers in the community. So definitely let us know if you're interested in, being a part of some of what we're trying to do. But also, the point in time count, we do it January and then July. So I'm sure that we'll be looking for volunteers to help us to go and get a snapshot of our community. So if anybody's interested in learning more about homelessness and what we're doing and all the great things the Bridge Home is doing, definitely let us know, and we'd be happy to have a conversation.
Thank you.
So, Loris Olson, do you want to unmute and ask your question?
My question may be a little cause a little concern about some people, but I've got to ask it. The last person just talked about what we are going to do. And I'm very concerned that once again, this report, which is very thorough, by the way, thank you, Dr. Flowers, okay, and really brings up a lot of different topics, but I'm very concerned that the leadership has already made itself selected. And that's going to leave out, once again, small agencies. It's going to leave out pilot projects, and it's going to leave out members of the public other than that and I'm one designated lived experience. So I'm very, very concerned about hearing CISS is in charge of all of this. So could someone please clarify exactly where the actual process is in the system of all of this? Thank you.
Pa, is that something you would like to address?
Yeah, I didn't hear that CIS was in charge of this, so I'm trying to understand what your question is. This is a community action plan, and the next step is for everybody to come together and figure out how we collaborate on this going forward. So I don't, if you heard that CIS was in charge of this, that was a misunderstanding. That I don't think we said that, but I think that there's plenty of opportunities. I think that one of the questions was how do we stay interested and get involved. Definitely provide your contact information. And I will ask for a little bit of grace. We're trying to figure out new strategies, trying to form new partnerships. I don't always get it perfect, but if you provide me your contact information, I've been sending a lot of mass emails. You guys probably hear from me a lot, and I'm happy to include anybody in the community in any of the outreach that we do. So please do send me your contact information, and I'll add you to the list that we have.
I think it's important to point out with a recommendation in this report to get more involved in the balance of state, that the Bridge Home was designated the lead agency for the Two Rivers region, and some of the pluses and minuses as a result of how the region functions right now is related to that. So now hearing that an outside agency is coming in is concerned. I've attended the balance of state meetings, et cetera. I just want to make it known. There's a lot of people out there with different groups and different ideas. So thank you for reassuring anyone can contact you and that it's not a done deal who's going to lead this. So thank you very much.
Can I just speak to that really quickly? It's Amber with Central Iowa Shelter Services. So I just wanted to make sure, Lori, that I apologize if it came across as that. When I say we, I mean the community as a whole, as we are working with the Bridge Home. And I absolutely put my email in the chat. And like I said, anybody who's wanting to be a part of it, I know that I've been a part actually of the Ames community for quite some time prior to my role here. And so I think that, you know, I know that there's a lot of great people, not just organizations, but people doing a lot of the great work that we are also doing. And when I say we, I mean the Bridge Home. And so it's never our intention to come into a community and make things all us. We don't want to be the end all be all for everything. We want to make sure that we're able to walk alongside the system to be able to serve the people that we serve the best that we can, right? And so if we can help in any way, that's what we'd absolutely love to do. And it's not just the Two Rivers region. We actually are over the 15 counties east and southeast of Polk in the Rolling Hills region. And we've established lots of programs out that way as well. So, but I put my email in the chat, and feel free to contact me to anybody on the call.
I also just added my email address to the chat as well, so please feel free to email me. I don't see any more questions or hands raised. Are there any other questions? Feel free to unmute and ask.
Pa, could you just kind of maybe give a little bit of a summary of what the next steps are going to be as people are aware? You know, the city and the county commissioned this report, and it would seem to me that as the two lead agencies, there'd be some responsibility and next steps. Would you just kind of comment on that, or what steps you see moving forward?
Yeah, so the immediate next step is, well, the next step for you all is to please complete the feedback form. We really want to hear your input about the plan and other strategies that we could consider, or any concerns that you have that you've heard tonight. We really want to hear from all of you. And so that's kind of the immediate next step. And then as far as the city and the county, the plan is to bring this homelessness action plan back to those entities for further consideration. So I'll let Sandra speak to the county, but for the city of Ames, it would be placed on the next council agenda, which is May 11th, for council discussion. So Sandra, I don't know if you have something to add.
Paul, if I could ask, I think someone put in your chat your email address. I would specifically ask that people, if they have comments or questions or want to participate, if they contact you directly. And in that way, there's a central collection point, and then council would be aware of that, and that can also be funneling that information to the county as well too, as we start to decide how we're going to move forward. And this is going to take some time planning. I know people are anxious to get things moving, and I think there's a lot of things that are I want to, for one, want to read through the report and understand it better. And there may be some follow-up questions for Dr. Flowers after reading the report. I know she kind of hit the highlights tonight. Sandra, go.
I just want to say that I do plan to take some information to the board probably within the next couple of weeks. Pa and I, along with Ashley, have been working closely on this project. And so one of the things that we would like to do is do an after action review on the process, take another look at the report, look at the feedback, and discuss with Dr. Flowers of incorporating some of that feedback into the report so that we will be able to share some of that with the governing boards and council as well.
And I'll add to that this effort to do this study was born from an asset board meeting where board members were expressing concern that the community was looking to asset to solve homelessness, which is a huge expectation. Okay? And so they were really asking admin staff to help us figure this out. And so there's a lot of work to do here, but I think that we have made some really good progress and continued progress as possible. So stay engaged. There was a question about, if you're not part of an organization, can you still stay in the loop? Absolutely. Anybody is welcome to email me. We'll add you to the list, or we'll keep you updated on what's happening.
Maybe it's possible that you could you put your email address or contact information on the same page where the report is posted to, so people have one landing point, makes it easier for people to try and find that information, and also how to get a hold of you.
Yep, absolutely. There's a question in the room, so let me talk over.
Hi, this is Patty Yoder, Executive Director of Food at First. Mine is more a couple of comments. One, what I see daily is a huge need for mental health services and addiction counseling. It's a huge part of homelessness and others. And if we could somehow figure that out, it would help so much. Secondly, if you want to experience some folks that are in some situation like that, come have dinner with us. Come to Food at First and eat dinner and get to know people. Sit down, talk to them, have a meal with them. It will open your eyes to very many things about what people are experiencing and the struggles they go through. And they're just, they're great people. They're people, just like you and I. They just have some issues at times and, but mostly we just need to treat them with dignity and help them where, on their level, where they need help.
All right, last call for questions.
Dr. Flowers, before you go, just to build upon that comment, can you wrap into what your recommendations are, or explain what are things that you are seeing other communities around the country doing to help address, help people who are experiencing homelessness with mental health and substance abuse, issues, in addition to just, I think it's something that we're aware of, but I didn't hear much about that. And maybe in your report, and I have not had a chance to read through it yet. So excuse me, I'm sorry, I apologize if it is, but I think it'd be good because I think it is something that we're aware of. And then I have a follow-up question after you talk about that.
Okay. And so what I do see as a movement that many communities are following is called the housing first model. And the idea behind it is that people need to have stable housing before they can address issues like mental illness or substance use addictions. That it's really, there's kind of a combination effect when you're experiencing homelessness. You're out in the cold and the dark, and you often turn to substances as a way of coping with homelessness itself. So the solution is really seen as solving the homelessness problem so that then someone can really focus their energy on the substance use problem that they may have. So that's what I see as being kind of the community response, is this homelessness first model.
And so what kind of creative programs are being implemented to help people once they are in this housing first? Let's just say that they are in a some sort of a shelter, either short-term or long-term. What are you seeing are some best practices and are being really successful that Ames could consider looking at?
I think peer counseling is one of the really successful models that's being used to address substance use in particular.
And then also, I'm sure you heard people just talking about just some of the groups of people, either congregating around the library or in the downtown area. And what are some things that are being done in other communities to help, again, meet needs, but also respect the challenges that it may pose for, let's just say, businesses or other people who are in those spaces.
Mm-hmm. So peer navigators and navigators in particular, which are essentially community health workers who go out into the community, identify people who are experiencing homelessness, and guide them to where they can receive services, is really kind of the best practice that I see happening. One of the issues, I think, for Story County and for Ames is that there isn't always space available during the day for them to go. So they end up going to the library because that's where they can charge their phone or have a comfortable place to sit for the afternoon. So providing alternative spaces, and then navigators, or in particular peer navigators, to direct them to those other spaces, I think is probably the best practice that I've seen.
Are shelters in other communities open 24/7? Because my understanding is that some shelters are not.
That's yes. And so shelters are often supplemented by day shelters, places where people don't necessarily want to spend the night, but they can get a shower, they can do some laundry, they can access services through a day shelter.
Last comment, I'll let others talk, and that is, isn't host not, they're not peer navigators, but aren't they filling some of that right now? And what's your assessment of that? Thank
Yes, they are a street outreach team, and so they are out there identifying people in need of services and offering them to them, and they're doing a great job from my understanding.
Yeah, hi. I also want to say, like, so in the chat, I mentioned mutual aid a lot. Mutual aid is basically a term for when people help other people in a more decentralized and grassroots way. I keep mentioning it because, like, it is very effective and it's a way to help people be empowered to address complex need like childcare that would take an entire program and an entire like grant writing system for a nonprofit to deal with. There also are a lot of writing from organizers over the years over the shortcoming of nonprofits, especially on funding, especially with POC writers. And I really want to see more of that literature and these ideas incorporated into conversations because because these are complicated. These are very complex topics that are going to require adaptive solutions that's going to need both a formalized structure and more of a grassroots structure as well.
Thank you.
Dr. Flowers, I have a question concerning housing first. Isn't the basic idea of that particular program to provide permanent supportive housing or at least housing for an extended period of time as opposed to shelter housing that the mayor referred to?
Yes, indeed it is.
Thank you.
I think a couple of the county board members want to make a comment. Linda Merkin and Latifa Faisal.
Okay. Hi, this is Linda. And Dr. Flowers, my question is specifics about the case manager position that's being proposed. And I looked quickly at the report and it looked like there was just about one page on it. I'm thinking about all of the participants that we have, all the people we have who are involved in providing services to unhoused individuals and how that whole system is going to be coordinated and how we make maximum use of resources and it doesn't just fall on one person. I know we've got host. Is there a community that does something like this, that you have an example that might have protocols, have policies that we could look at to help us further develop that?
It is certainly not unusual to have a coordinating case management position. It's often housed within a COC rather than a county. I'm sure I can find a best practice example and see if I can find some of their protocols or methods that are available. I'll look into that and see what I can add.
That would be very helpful. Thank you.
Linda, this is Latifa. I believe Douglas County, Colorado has does the homelessness coordination, or at least did a couple years ago. Dr. Flowers, this is Latifa Faisal, Board of Supervisors. Thank you for the work you've done on the report and all the research. I was wondering if you could maybe give us some more ideas or point us in a direction where we could get more information on homelessness as it relates to rural and very rural areas. In addition to the job fair, the Iowa Works bus, how do we have conversations with leaders in our rural communities to help them recognize that it is an issue for not just cities and large towns, but in their own communities? And how do we help create these conversations there in smaller communities?
And I agree. Homelessness is a different kind of a problem in rural areas than it is in in really centralized urban environments. And the best practices are hard to find in rural areas. I think rural communities don't always publicize their successes in quite the same way, so they can be harder to find. I have found a few examples. One is in rural Oregon, it's the COC that it oversees, I believe it's 28 rural counties and has coordinated services within those, and has done a really good job of it. So that's one example that I would point to of how a rural environment has been managed, where transportation is an issue. Overlapping services is an issue because providers are separated by so much geographical distance that the boundaries aren't clear. And so that's one example that I might point to. It's, I'll have to look. It's getting a little late. It's not on the tip of my head. I believe it's ROCC, Rural Oregon Community of Care.
Continuum of Care.
Continuum of Care. Thank you.
Thank you.
Okay, we have 3 more questions and then I think we're gonna cut it off, just given the time. So the Housing First model has been around for at least 20 years. Since you tout it as an answer, why is it not used more in the US?
That's a very good question. I think one reason is that people tend to blame homelessness on the individual and not see it as a systemic problem. So it's a little easier to say, well, there's no reason to help because that's, they have a substance use problem or they have a mental illness, and it's not necessary to help them because of that. And also because I think housing is expensive and requires funding and creative approaches to how to fund affordable housing in particular. It's not always profitable for developers, and it needs a little constructive development. Also, often there are zoning regulations that require, for example, a great deal of parking spaces for people who don't necessarily need them, but that make it prohibitively expensive. So it really requires a multifaceted approach to look at the funding, the zoning requirements, and the will of the community.
There are legal measures that can be taken regarding the homeless in the library. For example, is it possible to limit the use of the library to those persons engaged in the services of the library?
It may be possible. The library staff, the Ames Public Library staff, has been really great about providing services to people and trying to help them and direct them to places that they need to go or to know about. And I think that in some ways is part of the service that they provide to the community. The library is there for everyone to use. And so that's kind of the approach that they take.
And I would like to say, and I would like to add, because I'm this is Janie again. The Bridge Home meets at the library. We meet at least twice a week at the library to do street outreach. And we're also on their calendar. So if you would like to know when we're there, you can check the Ames Public Library's calendar.
Okay, we have a question in the room.
Have you had experience with modular housing for the homes?
Oh, with tiny modular homes? Is
Yes,
that, did I hear you right? Just a little bit. I know some communities have found them to be very successful. One of the challenges around them is that you still need power and water services and other kinds of infrastructure to supply them, so they can be fairly expensive.
And then our last question, does the consultant have an estimate of the percentage of people experiencing homelessness who are in need of acute mental health services?
I do not have that figure off the top of my head. I think from the pit count, it was a small percentage, and I think that that was probably a severe undercount. So it's difficult to assess. It's also difficult to assess because people who have mental illness and are chronically homeless tend to be more visible. There's a lot of hidden homelessness that is not necessarily counted.
All right, well, I am gonna cut us off here. I just wanna, maybe Dr. Flowers, do you have any closing words for us?
I just want to thank everyone for hanging here so late and for your interest in this topic. I think it's so important to the well-being of the community to have a place for everyone. So thank you very much for your interest and your concern.
Sandra, would you like to say anything?
Yes, I also want to thank everybody for hanging in there. I was looking for several to drop off, but most of you stayed on. So we certainly appreciate that and hope you will share some feedback with us.
And I'll echo that as well. I think we had upwards of 100 people on here at one point, and there's still many of you on. So I think it's just another testament to us wanting to come together to work on this issue together. So thank you all for that. And as I think we just dropped the link in the chat again, so please let us know what you thought about the session. As a reminder, the full report is available online now. So for you overachievers, it's available. Go to sleep tonight though, read it tomorrow. And then we'll make sure that we can provide the recording tomorrow as well. We'll work hard to get that available online tomorrow. If you have been getting a bunch of emails from me, you will get another one tomorrow, just reminding you where everything is. And if you complete the feedback form today too, I'll include your email addresses if you've provided it in that notification as well. So just a huge thank you. Thank you, Dr. Flowers. There was a lot of information our community gave you. And I think you have really done a great job giving us some direction on where to focus. So thank you so much.
Thank you.
Sandra, will the report be on the county's website also?
Yes, it will.
Okay, perfect. Thank you.
All right.
Thank you, everybody.
Thank you.
Thank
Good night.
Good night.